Hi, my name is Dr. Tony Salame. I'm a doctor of chiropractic, and I have an office here in Panama City, Florida, and dealing with chronic health conditions such as fibromyalgia, chronic fatigue, migraine headaches, autoimmune disorders, chronic pain, and a whole host of other chronic health problems. I also hold a master's degree in clinical nutrition, and I have several postgraduate hours in functional neurology, blood chemistry, and endocrinology. Over the years, I realized that many people like you have been greatly underserved when it comes to finding the underlying cause of your health problem. Some of you have been to 5, 10 doctors and even more, and are not getting the answers, or haven't been listened to, or haven't been thoroughly tested for. And conventional medicine, they're great when it comes to emergency care. They're very good when it comes to blunt force trauma, heart attack, stroke. But when it comes to chronic care, they're just lost in a lost world. They treat chronic health problems with acute care, and it just doesn't work. Well, I'm here to tell you that there is an answer to your health problem. And the only answer comes when you find out what's actually causing it. I'm sure you've heard the saying, nothing ever really goes away until you find out what's causing it. Until you remove the cause, it always comes back. And our focus here at our clinic is to figure out what's causing your health problem. And the way we do this is we use cutting-edge methodology and scientific protocols in order to find out what's causing your problem non-invasively and with natural means. Today we're going to touch on the condition called fibromyalgia. Now, if you have fibromyalgia, you know what that means, which is pain, diffused pain all around the body, in the joints, in your muscles, and in your tissues. And with fibromyalgia, many patients that we see that have fibromyalgia are under pain medications. Some of them are very dangerous, like narcotic pain medications like tramadol, that are addictive. Some fibromyalgia patients are on Lyrica, which is actually an anti-seizure medication that really doesn't do anything to actually treat the actual problem. Others also, you might be put on Prozac or Zoloft or Cymbalta, which have serious side effects with the antidepressants and anti-anxiety medications. And a lot of people with fibromyalgia have problems with fatigue. In addition to the pain that they have, they're constantly fatigued. It's hard for them to get out of bed. They wake up in the morning. They're slow starters. In the midday, they may have a midday crash. A lot of them have immune problems as well as hormonal problems, and are problems with staying asleep as well. They can't get to sleep, and some of them have problems staying asleep. And with fibromyalgia, others have also may experience weight problems, may experience also blood sugar problems as well. I want you to know that we understand that fibromyalgia is real. Today I'm going to talk to you about the causes of fibromyalgia and the treatment methods that we use in order to treat you with the fibromyalgia. Now, in fibromyalgia, the mechanism is very similar in each patient. However, the causes and the triggers are different. Now, this all starts with the brain. In the brainstem, there are three major areas. You've got the medulla, you've got the pons, and you've got the midbrain, or what's called as the mesencephalon. The brainstem is the most vital area in our bodies. All our major neurological pathways go up and down the area, communicating with the rest of the body. Normally, the lower part is supposed to inhibit or slow down the upper part. But in fibromyalgia, they lose that functional feedback, where the lower part is not doing the job of inhibiting the upper part of the brainstem, which the mesencephalon. And what happens is there are aberrant signals, or signals that hyperactivity of the tracts that go downwards to the rest of the spine and create the nerves to be hyperactive, especially the area where the nerves are feeding out to the adrenal glands. What happens is the body is releasing what we call as catecholamines, which are your adrenaline hormones or your stress hormones, and they're mainly epinephrine or norepinephrine, which causes high blood pressure, speeds up the heart rate, it can cause excess sweating, it can cause problems with sleep, it can cause problems with high blood pressure, blood sugar metabolism problems, and more importantly, it causes pain fibers to be sensitized. They're primarily your C-type fiber pain. And when that causes that sensitivity, many fibromyalgia patients have that sensitivity to the touch. Medically, we call it allodynia, and that is that sensitivity that these fibromyalgia patients have. And even we find fibromyalgia patients actually in pain just by wearing their own shirt or pants. They feel that they're, in pain because, their nerves are always sensitized. So that's what we find with fibromyalgia is the main point is that the lower part of the brainstem is not inhibiting or slowing down the upper, and that's going out of control. So there's a reason why this happens. And the reason why this occurs is different, and it varies depending on each individual that has fibromyalgia. For instance, some fibromyalgia patients have food sensitivity. Some fibromyalgia patients have chronic infections, heavy metals. A lot of them have a mixture of both, of all. So what we need to do in order to assess the cause of fibromyalgia and treat this debilitating condition is we need to actually look and find out what is actually triggering it. What we do is once we find those triggers and we remove those triggers, then we need to be able to restore the function and rewire the nervous system. So I'm going to talk to you about different triggers that trigger this and that causes fibromyalgia. So first we talk about food sensitivity. Food sensitivity, we're talking about your wheat, your gluten, your soy, eggs, milk, dairy, casein, and other grains. And a lot of people with fibromyalgia have food sensitivities or food allergies. And when we're talking about food allergies, we're not talking about you eat a peanuts and you go straight to the hospital. That's not the type of food allergy that we're talking about, or you eat some type of nut and it gets you to an anaphylactic. That's called an anaphylactic food reaction. That's an anaphylactic allergy. So this type of allergy is very different. It's actually a delayed allergy. It creates chronic inflammation in our bodies, and it causes us to inflame. And when it causes chronic inflammation, that's a problem with fibromyalgia patients and a lot of chronic health disorders with other conditions because they're constantly inflamed. So we need to look at your food sensitivities. We need to look at your corn. We need to look at your cross-reactive foods, your yeast. We need to see all of that. But what happens is, if you're allergic to any one of them, and if it shows positive, then we're going to need to remove them out of your diet. And if you're not willing to avoid those foods that are creating that inflammation, that hidden source of inflammation, if you're not willing to do that, then there's really no point on even starting, because you're not going to get well. The worst thing that I would have is for a patient of mine to start care and not get well, because that would be wasting your time, my time, and your money. And I wouldn't do that. I'm not trying to be rude, but I'm being direct with you that, if you don't have the mindset that you're willing to do what's necessary and you're committed to your health, and if you're sick of tired of being sick and tired, and you have the mindset that I am willing to do what's necessary in order to get better, from this condition, that's the person that I want to work with. People with food sensitivities, what do they have? Food sensitivities. People with chronic pain or fatigue, frequent indigestion, problem bloating, constipation, mouth ulcers, or sores. Some of them have diarrhea or an alternating bowel movements. They're just not functioning right. There are a lot of different things that cause a lot of symptoms that cause as a result of food sensitivity. So those are very, very important that we're going to take a look at. Another thing is we're going to look at your thyroid. We want to take a look at how your thyroid is functioning. If your thyroid's not functioning properly, then we're going to take a look at that. And we're going to be able to assess the thyroid function, and we're going to be able to do this thoroughly, because most people who have fibromyalgia are not being tested thoroughly. The way we're going to look at your thyroid, we're going to look at your total T4, your TSH, your free T3. These are all metabolic markers that are going to give us an indication of what's going on with you. A lot of people who have fibromyalgia have problems with their immune system. Their immune system is actually attacking their thyroid, and that never gets addressed usually. It never ever gets addressed because medicine does not look at immune problems with thyroid. And those things are prevalent with thyroid patients and fibromyalgia patients. So we need to look at that. Also, we're going to look at your complete metabolic panel. We want to take a look at your liver, enzymes, your kidney, electrolytes, so on and so forth. We're going to take a look at your immune system, your CBC. Take a look at your autodifferential. That's going to give us a picture about what's going on with your immune system. We're also going to take a look at these inflammatory markers that I talk about. There are many different inflammatory markers that will assess how much your body, how much inflamed it is. We can be able to find out how much your body is inflamed and what's causing it to inflame. Also, we'll take a look at your adrenal stress index test. That the adrenal test will tell us how your adrenals are functioning and if they're not functioning properly and what stage they're in. Because a lot of fibromyalgia patients, their adrenal glands, those are almond-shaped glands that are sit right above the kidney. They release the cortisol. They release those adrenaline hormones that cause the heightened, increased blood pressure, increased heart rate, problems with sleep, fatigue, energy. These all have to do with those type of functionalities. If they're not functioning properly, there could be a time and day where they're not regulating. So we need to take a look at that. We'll also take a look at your immune panel to actually see and really dissect the inside of your immune system. What's not working properly. We need to see if there's any autoimmune disorder. An autoimmune disorder is a disorder where your own body is attacking your own tissue. So if your body is attacking your thyroid or is attacking your adrenal glands or attacking your brain, because there are antibodies that will actually attack your cerebellum and affect your brainstem. And if your brain is inflamed, then that's a huge alarm that we need to take a look in, because that could be the underlying cause of your problem, and that's not being addressed properly. So we need to take a look at your immune system, because the immune system trumps everything. And the problem with modern medicine is they do not look for functional problems. They don't look for these type of things. They do not test you thoroughly. And that's why the chronic diseases are on a rise, and it's just increasing and increasing. So we'll be taking a look at that. We'll also take a look at heavy metals. Heavy metals are a big problem when it comes to your metabolic system. And when we talk about metabolic system, we talk about your biochemistry, your nutrition status. We're talking about toxicity levels. These all attribute to metabolics. When we look at your heavy metals, we're going to look at the major heavy metals such as mercury, cadmium, aluminum, lead. These are all important because these metals can get into the system. They can damage the nerves. They can cause the nerves to be heightened and sensitive. They can cause a lot of havoc on the body, and it can also rev up your immune system, which causes your body to be over-dominant if that's a factor with you in fibromyalgia. That's why we have to test that before we proceed further. Also, we'll take a look at your blood sugar levels, obviously, because that's going to give us an idea of your adrenal function. That's going to tell us about your metabolic system, because the blood sugars really control so many different things. They control hormones. They control everything. They control a lot. So blood sugar metabolism is very, very important and imperative in order to assess for fibromyalgia problems. We're also going to look at your intestines. The intestines are such an important thing because your intestines is your immune system. 70% of your immune system is in your gut. And if your intestines are not healthy, if you've got bacteria functions, yeast, parasites, viruses, and if you have a mixture of these, and these are constantly in your gut, your immune system is going to be constantly on the rise. It's going to be constantly revved up, and it's going to be constantly affected. So we need to take a look at your intestinal system to see what the ecology of your gut. And once we see that, we also need to take a look at the lining of the gut. Because even if we kill these infections, even if we try to eradicate them, but the lining is not strong, there's no good barrier, what happens is these infections seep back in, and they constantly cause problems. That's why many fibromyalgia patients are not getting well. They're taking different nutrition, and they're not able to assess the whole. They're not able to overcome it. You see, to take care of fibromyalgia, it doesn't come in one particular form. It doesn't come in nutrition. It doesn't come in a pill. The whole system needs to be looked at first. Once you find out the cause, then you can find an action plan put in place in order to take care of that and remove the cause of these problems and actually restore the function to greater health. So when we look at metabolics, how do we actually target it? So we found the problem. We found all these different factors, these triggers that are causing problems in the biochemistry of the body, causing problems in the hormones of the body. We assessed for your toxicity levels. We assessed different triggers. How are we going to address this? Well, once we find out what's going on with you individually, what's going on with your particular problem, your biochemistry, once we do that, then we'll be able to treat these problems through proper nutrition. And that's nutrition that's tested for, that's premium grade nutrition. And we'll use a lot of it, we'll use as whole food nutrition, organic foods that really rebuild and restore the normal biochemistry of the body. Also, we'll take a look at different herbs that help with fibromyalgia to be able to start restoring the function of the body. And we'll look at nutraceuticals. These are natural extracts from different vitamins and amino acids that help speed up the healing process and get you on your path to health. So then we have what we call neurological treatment. What do we mean by neurological treatment? Neurological treatment, we're talking about your body's nervous system. Remember how we talked about how the lower part of the brainstem is supposed to slow down the upper part of the brainstem? Well, there are other things that are going on in the brain, and we need to assess where these problems are coming from. Are they coming at what centers of the brain that are not firing properly? In addition, we need to look at all these different systems in the brain, down towards the spinal cord, down towards the nerves where they exit to. So we need to find out the level of the lesion or level of the problem and start treating these areas. And how do we treat them? Is by restoring normal communication, from the brain down through the spinal cord out to the organ. So the way we do this is through chiropractic neurological adjustments. These are specific adjustments that will normalize the communication network between your brain, spinal cord, and to your organs, and vice versa between your organs, spinal cord, up to your brain. Both are very, very important in order to get that communication system working better. So once we get that communication system working better, your organs, everything's going to function better. Your heart, your liver, your spleen, your intestines, your thyroid, everything's going to start working better. So we will look at you neurologically. We'll be doing neurological tests to assess where these problems are at and how they need to be treated. And the way we do that is through specific chiropractic adjustments. These could be done through the hand. They can be done through instrumentation. They can be done through visual stimulation. We can use glasses, hemifield glasses that will stimulate different areas of the brain. We use auditory stim. We can use various different neurological treatments to normalize brain function and allow the body to start to heal at a core level. Also, we also use craniopathy. Craniopathy is a form of actually treating the cranial bones, making sure that the cranial bones are moving properly in proper motion, so that the cerebrospinal fluid that nourishes the nerves is actually flowing properly. We also look at your reflexes. So a lot of times people with fibromyalgia have reflexes that are coming from different organs. For instance, the intestines, for instance, will reflex into the lower back area, and they chronically cause lower back problems, lower back pain. So what we have a technique that we use that normalizes the relationship between the organs and the brain, and back forth between the brain and to the organs. So between applying various different methods, vibration therapy, different things, it's going to help reestablish and rehabilitate that nervous system so that the nervous system can start to heal. And as you start getting that control system working for you, the biochemistry starts to change, everything starts to working better. So the way we really look at you is we look at you neurologically and metabolically. Neurologically, we have patients that come anywhere from once a week, 2 times a week, some of them 3 times a week in the beginning. And they get these therapies so that their body can start to restore the function. Another thing is, as far as metabolics, we do all the testing. We use different private labs that we use to specialized private labs that will do this type of advanced testing. We'll get those testing, get the results. We'll start treating you nutritionally, finding out what are the problems first, and what nutrients are going to be tested and proven to actually get you back to health and get rid of those triggers and causes. Now, most of our patients that come with chronic health conditions, we have them, they either commute from 2 to 3 hours to come and see us. We treat them neurologically, we treat them metabolically. Now, if you're in an area where you can't fly in and get tested, we do have local labs. We have specialized labs that you can get anywhere you live in the country. We can take a look at you metabolically, look at your triggers, look at what's going on there and your biochemistry. And we can consult with you through either phone consultation or Skype through video, and we can find out what's going on there. I'm going to ask you the following 4 questions. Question number 1, how has your chronic health condition affected your job, your finances, your relationships, or any other activities? Number 2, what has this costed you in time, money, and sleep? Number 3, where do you picture yourself in 1 to 3 years if this problem is not taken care of? And number 4, what is it worth to you if we could improve your condition? If this is something that you're serious about, it's something that you want to get well, then I'm serious about working with you. And I want to personally invite you into my office for a consultation. There will be no charge for that. I'll take a look at your file, take a look at all your medical records, all your diagnostics, your lab work. I'll sit down with you, go through your history, and I'll see what we can do for you. I'll tell you basically if I can help you. Now, if this interests you and this is something that you're serious about, then I encourage you to give us a call. You can also fill out your information and get your email address. We'll also, somebody from my staff will be in contact with you shortly to set up your appointment. And I want to personally thank you for watching this video. I'm Dr. Tony Salome, and have a great day.